I'm Linda Hagen. I'm with Dr. Comfort. Today I'm going to show you how to size and measure graduated compression hose. I have my model Kathleen with me today. The first thing you want to do is make sure to remove all your rings, because rings can cause holes or snags in compression hose. The next thing you need is a tape measure. The tape measure I have already locks in the size. Kathleen has taken off her shoes and socks, because that is the best way to measure for graduated compression hose. You want to measure the smallest part of the ankle above the bone and the widest part of the calf. I'm going to take my tape measure, again, smallest part of the ankle above the bone, and Kathleen at her ankle measures 8 1/4. Then the widest part of calf, and it's different on most individuals. It can be lower, it can be higher, it might be in the middle. Sometimes you can push the calf muscle and find out what that is if you're having difficulty. Again, the circumference, not real tight, just comfortable around the leg, and Kathleen is 14 1/4. You also want to measure both legs, because on many people, one leg can be a different size. So again, using my tape measure, smallest part of ankle above the bone, and Kathleen is 8 1/4 on that ankle also, and 14 1/4 on her calf. Then you take your box of Shape to Fit, and the sizing guide is on the side, and you match up the sizes with your measurements. Kathleen fits very nicely into a size medium. You can also look in our Shape to Fit catalog, and that will give you our sizing guide for all of our compression hose. So, since Kathleen fits in a medium, we have a medium graduated compression Shape to Fit stocking, and donning is very simple. One of the easiest ways to don is to put your hand into the stocking, pinch the heel with your thumb and forefinger, and keep pinching. Turn the inside of the stocking all the way to about the knuckle of your thumb. And now you've made a nice pocket, so your foot can be placed in very easily. I'm going to show you how easy it is to don graduated compression hose on a patient. I take the stocking and pull it over the foot and to about the heel. Now, you want to make sure you can get the toe area in, and then you pull the stocking up. You don't have to pull it or yank it. It should work its way up very nicely. And you want to make sure the heel pocket is where the heel should be. And work that up. The stocking should go up to about 1 inch below the knee. Now I'm going to straighten out the toe area and the heel. Does that feel good?
Yes.
Another thing you can use to help don graduated compression hose are gloves. Dr. Comfort Shape to Fit does sell latex-free donning gloves. And sometimes this does help to straighten the stocking out, especially if someone has a larger leg. It makes it a little more comfortable if you're donning that stocking on them. But also, these work very well for the patients themselves to aid in donning. For removal of the stocking or doffing, the easiest way is to take it off like a banana peel. Pull it all the way down and pull it off like this. because if you push the stocking all the way down and it gathers around her ankle, it will create a tourniquet effect, as well as you have about 30 rubber bands now you have to pull off around the heel. For washing your hose, the best way is to use a mild soap that does not contain bleach or fabric softener. Stockings, graduated compression stockings, should last anywhere from 4 to 6 months with proper use. To use the donning stand, you want the closed area of the donning stand toward your body, and the stocking, the heel part, should also be toward your body. Now Kathleen is going to show us how to use the stocking donner. She opens up the stocking and gently glides it over the middle part of the stocking donner to about the heel area, or where there's a nice pocket where your foot will go. Then she places it on the floor, maybe a little bit behind her body. Make sure there's a steady table or chair so you can balance yourself. You point your toe, slowly step down into it, and then grab the padded handles and pull it up toward your knee. Then you may remove the donner. It may need to be adjusted a little bit, and this may take a little bit of practice, but using it after a few times, I'm sure you will find it an easy way to don your shape-to-fit graduated compression hose. We are now going to demonstrate donning an open-toe graduated compression stocking. Our stockings automatically come with a silky toe slip in the box to aid in donning. We're going to demonstrate this. First, you would give the patient the toe slip to put on over his foot. Slides on very easily. Then, the open toe stocking, the patient can put his hand in the inside with his thumb and forefinger, grab the heel, continue to hold that as you turn the stocking inside out to make a nice pocket for the foot to slip into. Very slowly put the foot into the stocking and pull it up to about the heel area. Then grab the end of the stocking and continue to gently work it up your leg. The stocking should stop about 1 finger width below the knee. This is a very easy way for people to don stockings, or for people that have larger feet, hammer toes, bunions, or maybe just wish to wear a sandal. After the stocking is in place, your patient will be able to pull the toe slip out very easily, and that is a way for someone to don stockings that may have some difficulty. They may also put another stocking over their foot for protection. Thank you for watching this educational